Hey, I'm Steve Rissman, the program chair for the Workers' Compensation Educational Conference. This year, the Workers' Comp Educational Conference is held at the Orlando World Marriott from Sunday, August 17th to Wednesday, August 20th. It is, as all of you know, the largest gathering of workers' compensation professionals in the country. Not only is our program a terrific one, but it's a really good place to network as well. Speaking of the program, you football fans will want to know that our keynote speaker on Monday is Hall of Fame quarterback Jim Kelly, Buffalo Bills quarterback. And our Monday night entertainment at the reception features Kenny Loggins. For more information about the program or hotel accommodations, simply log on to WCI360.com. I'm here today to talk to you about what I consider to be the most exciting part of the program and one of the most interesting events at the convention as well. It's what we call the live surgery. It's one of the most talked about and attended events of the convention. Orlando Orthopaedic Center has been our partner in this part of the program since its inception several years ago. Basically, the surgery is performed at the Surgery Center, and we stream it live and interactively to our audience at the Orlando World Marriott. The doctor talks to the audience, and the audience gets to talk to the doctor. This year, we have two surgeries by Orlando orthopedic doctors, Dr. Joe Funk and Dr. Bryan L. Let's start with Dr. Funk. Dr. Funk, what surgery are you going to perform for us at the convention?
We're going to do a plantar fasciotomy, which is a pretty common condition that we see in the office. Very easy procedure for the most part, definitely under 15 minutes. So it'll be easy to do that and be able to communicate with the crowd.
Why is it important that the audience know about foot and ankle injuries, Doctor?
Well, in general, we see a ton of lower extremity injuries here at Orlando Orthopaedic Center, from crush injuries, pallet jacks, falls, some overuse conditions, some inappropriate shoe wear activities can sometimes lead to plantar fasciitis and sometimes be covered, and then ultimately is what we're going to see today.
So a lot of the workers' compensation patients that come through Orlando Orthopedic would come in for either ankle or foot type of injuries.
Well, yes, but of course we have 19 docs here, so I'm one of two that really focus on the lower extremity, and we have board certified for every body part.
Virtually everybody in the audience is a non-doctor. Why is it important for them to know the details of this type of surgery?
Well, you know, we do these cases, and we have constant communication with those who are approving or who are working behind the scenes. And quite often, all we know is a name or a number or a card. It's really nice when we can get together, we can put a face to name. That's the networking component, and that's the wonderful thing about the conference, where we can do that. As far as the procedure goes, it's nice to know what's going to be done. One of the most common questions I get quite often during approval time or immediately post: how long is the procedure? What do we expect post-operatively from that procedure? Are we looking at a 1, 2, 4 week before light duty? How much time off? And getting an idea of kind of what we do, the invasiveness of at least the two procedures we're going to see here, will give an idea of kind of what the patient has gone through, and then ultimately what would be reasonable post-operatively.
And although this is really fun to watch and exciting for adjusters who don't get to see this sort of thing, it really has a huge educational value for them, because most adjusters are having to make some medical decisions, and they're doing it just on reading reports, which makes it more difficult. But when they see something like this actually take place, then I think they become more aware of what's actually taking place in the operating room. Do you agree?
I do, and maybe more appreciative. For example, the plantar fasciotomy that we're doing, it's really not a time-dependent procedure. A week, 2, 8, 22 later, that's fine. Unlike some of the crush injuries or multiple bone fractures, these are things that we must get approved and we must get in now, because if we can do them within the first few days or week, my job is very easy, and you want your surgeon to have an easy job. When we don't approve that displaced fracture until week 2, 3, or maybe it gets set on off on the sidelines, and we see it and it needs to be put back together at week 2 plus 3, 4, sometimes it can be almost impossible.
What's the off-work time for this type of surgery, Doctor?
Classically, plantar fasciotomy is a soft tissue procedure, and while it does increase some discomfort on the bottom of the heel, in most patients that I do, my recommendation is no return for the remainder of that week. Let's say we do it on a Thursday. I follow them up on a Monday, Tuesday, and they would be able to allow to go back light duty at that point setting. If it's really a nervous Nelly, or if maybe there's some other circumstances I'm not aware of, worst case scenario would be 2 weeks, then allow light duty, mostly setting, of course. About 90% of patients that have this procedure feel as good, if not better, than they did preoperatively, somewhere between week 4 and 6. So, unless we're dealing with some other issues, typically most people can go back. Now, really super heavy labor, lifting, climbing, ladders, pushing, pulling of hundreds of pounds, it could be 8 weeks, could be even more. Before regular duty.
Let me just ask one more question, Doctor. I know Orlando Orthopaedic is an exhibitor at the convention. I don't know whether you actually spend a lot of time in the exhibit room or not, but tell me what the benefit would be to a large orthopedic association to be an exhibitor and to come out to the convention just to network.
Well, in this business, a lot of folks have their favorites, one way or another. But again, like we talked about earlier, you don't often have a face with that name or that card. And this is a benefit for us to get to know each other, name to face. It's an opportunity for us to go out there and they can see, and quite often the people we talk to on the phone have never seen our office. They talk to a contact person or sometimes us. But we get to put face to name. They get to see us almost in a social environment, and quite often at that conference they do. And it's a real great way to develop relationships. I'm not Dr. Funk, stuffy, crabby. I'm a real guy, that can loosen up a little bit on occasion, and vice versa. So it's a super opportunity to network.
We've heard from Dr. Funk now, and I would like to introduce you to Dr. Bryan Bruce, who is going to talk to us about the surgery that he's performing at the convention. Dr. Bruce, what type of surgery are you going to be performing at the Workers' Compensation Educational Conference?
I'm going to be performing a shoulder labrum repair. The labrum of the shoulder is the cartilaginous ring around the socket or the glenoid. It's important because all the ligaments attach to that labrum. So when that labrum were to tear off in an injury, then the ligaments would also tear off and would cause some potential instability of the shoulder, which can be painful, can give the patient a feeling of instability or no support or strength of the shoulder. So it's important to recognize those injuries and treat them accordingly.
Why is it important for the audience to know about shoulder injuries? What is specifically important for adjusters and employers and nurse case managers and our audience to know about shoulder injuries?
Well, I think in general we get kind of put into a category of surgeons who take care of things like back injuries, especially to the work comp population, because that's probably the most commonly injured part of the body. But there's a lot of other joints or structures in the body that can be injured. Myself, I'm a sports medicine specialist, so I treat injuries of the extremities like the shoulder, the knee, or the hip. And since we're specifically talking about the shoulder, many of our shoulder surgeries are done arthroscopically. And when you do a shoulder surgery arthroscopically, the nurses and the adjusters and the attorneys and everybody may see that person's incisions, and they may see a few poke holes, and that doesn't really explain the process of what's going on inside the shoulder. Because what we're doing inside and what we're going to try to show during the live surgery is it's a pretty technical surgery. It's pretty intricate with the sutures that we place and the management of that labrum to get it reattached. And although we can do it through some small poke holes, and that's pretty cool, and it's minimally invasive, it's important for them to see what happens on the inside to understand the technicality of it.
Virtually everybody who's going to be in your audience, this is different. This is a different surgery, and I believe we're the only convention in the country that really does this. You do surgeries in seminars for other doctors, but this is a seminar where nobody in the audience is a doctor, and virtually every single person in the audience will be a non-medical person, or at least a non-doctor. So what do they need to understand about shoulder surgery? What do they need to understand is important for them to know about this type of procedure?
Oh, I think basically that it's just a lot more technical than they can probably imagine until they see it. As doctors, we could all be in a room talking about it and really understanding the intricacies of the labrum and the types of labrum injuries. But for this audience, really they just need to see, what the heck a labrum is and how those ligaments attach and what we're trying to accomplish when we reattach these structures. But also to see, how how intricate that can be, but also sometimes how tenuous that repair can be. And if we let them go back to work or to some activities too soon, they can disrupt the repair. So it's important for them to see, the technicality, but also the tenuousness of the repair on occasion.
Well, that leads me to my next question exactly. In this type of surgery, what's the average or proper time that an employee will be off work, and when he returns, do they return to light duty first and then to full duty, or what's the story with going back to work?
Well, typically, obviously, it depends on the type of work the person does, but those first couple weeks can be quite painful. Many patients will get a nerve block to numb the shoulder and the area around the shoulder so they have limited pain, so their arm won't even work for the first few days. But after that first week, the pain's much better controlled. Many patients can even get back to a sedentary job within 2 weeks after surgery, using limited, keyboard typing or writing or even answering phones with the contralateral arm. But by 6 weeks, most patients can do most activities of daily living and typing and writing and shuffling around some light objects. But it's usually a good 3 to 4 months before somebody can do any heavy lifting, any overhead lifting, any throwing or anything like that. So generally, of course, it depends on the job, but it can be anywhere from a 6-week to a 3-month period before they're back to full duty, and as long as 6 months before somebody's 100% back to all activities in general.
They can recover from this 100%. Then.
Yes, they can.
Well, let me switch the subject a minute to networking, because that's a big reason why a lot of people attend the convention. And Orlando Orthopaedic is an exhibitor at the convention, and they take sort of great pride in their networking. A lot of the doctors are out there a lot during the convention. Why would that be important for doctors to be exhibitors or networkers? Why do you care?
You hit the nail on the head, Steve, with regards to our taking a pride in the Work Comp Conference. We've always been a big advocate of performing the live surgeries, being a part of that. Also being an exhibitor. For me, the exhibitor portion is really a great opportunity for me to get in front of the adjusters, the attorneys, even some of the other physicians, and the employers and some of the big CEOs and the bosses, to let them know what services we provide, because it just feels like there's not enough time in the day. I'm always seeing patients in the clinic or in the operating room, and this is a great opportunity for that informal setting for us to really get in front of the people, for them to ask us questions as well. We want to be accessible as much as we can as well. Work comp injuries are a big part of what we do as orthopedic surgeons. We don't take that lightly. We take it very seriously. These are good people that get injured. We want to be a part of this. We've always enjoyed being part of the convention, but also just work comp in general, and we want to continue that in the future.
Thanks. The last question I have has to do with the Orlando Orthopaedic Foundation. It is really the presenter for this live surgery. Tell us about it in a few seconds, please.
The foundation was formed a few years ago by one of my partners, Randy Schwartzberg. Is his vision. I've also carried on that same vision. It's a great avenue to really direct some of our attention towards things that we can't do on a day-by-day basis. Things like research, things like community involvement, getting money towards kids to go to camp or to put shoes on homeless kids. A big focus for myself and Dr. Schwartzberg is to do the research as well as to do the injury prevention. There's a lot of opportunities out there for us to provide education for the youth sports and to help prevent some of the injuries that really can happen with just simple overuse types of activities. So we feel very strongly about that. The foundation was a great avenue to get that accomplished. Of course, all these things need money, and of course, forming a foundation is a good way to get people to donate to that. And so we're always looking for money, Steve, and we hope to continue to see that grow.
Thanks, Doctor. This is Steve Rissman, the program chair, wrapping up after talking to Dr. Funk and Dr. Roos about this exciting live surgery that we're going to have at the Workers' Compensation Educational Conference. If you want to find out more about the conference or register it, please go to WCI360.com.